Welcome to DY Med Talks, the official podcast for the DY Patil School of Medicine, Navi Mumbai, where we explore the intricate world of healthcare and medicine. I'm your host Upasna, and today we have with us a very special guest. Please join me in welcoming to the podcast Dr. Sanjay Dhar, professor in the Department of Orthopedics at DY Patil Hospital, and also the president of the Bombay Orthopedic Society. Thank you so much, sir.
Thank you. Thank you for the kind words.
So, before we begin with the questions for the day, I would really like to ask you what made you pick orthopedics as a career and what made you want to specialize in the spine?
Orthopedics, as I go back in my memories, actually I didn't plan orthopedics. I planned medicine definitely. I wanted to be a doctor. While during my student days, even during my clinical posting in orthopedics, and an internship, and then place where I have studied from is Kashmir. In those days, we had 2 years PG, and then we had house job, which was 1 year house job. So that time I chose orthopedics, and I really got attracted to it. Putting up broken bones and then making somebody stand, and because you see them slowly, and that gives you a lot of satisfaction. So that's what appealed to me, and I wanted to be. In fact, it was a very high number one for me to be orthopedics. So next subject was very low down. So that's how I chose orthopedics.
And we're really glad that you chose ortho as your career choice.
And I think you asked that why did I choose
Specialize in
spine
the
surgery?
spine.
Spine surgery also, see, when I came to Bombay, I landed up in Sion Hospital, which is a very high volume center, and a lot of trauma, a lot of spinal disorders, spinal infections. So I worked with people who were doing a lot of spine. Dr. V.T. Nahalkar was my teacher, mentor in a way, and he's a well-known spine surgeon. So I had the privilege of working with him for more than 2 years, in fact. So that sort of attracted me, and spine was a very evolving field that time. New instruments were coming, new implants were coming, so it really gave a lot of pleasure doing those cases, surgeries. So that's how, and maybe the volume of spine surgeries was much more there. So that's why.
Thank you so much for sharing that experience with us, sir. I think for our listeners, it's really important that I point out that we have had the pleasure of having sir with us on the occasion of World Spine Day. For our listeners who are not from the medical field and don't know what it is, World Spine Day is celebrated every year on the 16th of October, and it celebrates initiatives aimed at promoting spinal health and also organizations that work towards people helping people who have spinal health issues. So, sir, I'd like to ask you, why do you think World Spine Day is important?
See, there are different organizations all around the world who try to focus the international attention on these, like you have Arthritis Day, the Spine Day. So, spine is spine, so it is something which holds your body erect. So, if you need to move around, you need to, and disability is a very important cause
Yeah.
of debility in our society, because if you attend my OPD, you will see out of 50 patients, almost 30 are spine patients. They
Yes.
have backache. They may be minor, neck pain, backache, and now we have this. The whole world is sitting on a computer almost every day, so it's a very large volume. Initially, we used to have only old patients coming for spine problems, but now we have young people like you, who are in 20s, and in fact kids also who study very hard for their classes and all that. So all of those come for the spine. So it's a very large volume of patients and a large cause of disability in human beings. So that's why the organization think of this as a sort of an awareness campaigns on that day can be sort of reiterated and made more focused. So that's why we have World Spine Day on 16th October.
I think so. You really did highlight the importance of spinal health in today's world. And on that topic, we actually have a few questions from our listeners about World Spine Day. So I'd
Sure.
love to ask you some of them. The first is, could you explain the significance of spinal health in our daily lives as medical and non-medical people?
So as I told you, but now everybody is sitting on a computer, you're either on mobile phone, you're on the laptop, or you can see people sitting on the desk and working on this. So everybody needs a good spine to hold this body posture well. So that's why the importance of spine is because in our everyday life, the mobility of spine, its deformities, they are form an important part of our how we spend the day or how we spend rest of our life, whether we are. And people now drive cars every now and then. So 2 hours driving to the city, you can see that that is not the normal posture of spine. We are not human beings. Are not supposed to sit all the time. We are supposed to be erect. We have moved from four-ped stance from of animals, monkeys, to two-ped stance. We stand on only two legs. So our spine needs to maintain that curve and that profile for us to do our daily activity. So that's why it's important that the spine health is taken care of.
Thank you so much, sir. And what would be some common misconceptions that the general public has about their spinal health?
Oh, so many. There are so, like, as I told you earlier, we used to have only old people walking into our OPD
Yeah.
with spine, backache, and all that. Young people thought that it will never happen to them. It may be late 50s or 60s when they will start. But now, as I told you, in fact, majority of patients are now
The
younger
younger
patients, so
patients.
20s, 30s. In fact, we are surprised to see kids. I mean, somebody who's preparing for his IIT or medical class,
Entrance.
who works almost 8 hours a day sitting on the desk, then goes to classes, and at home he's sitting again. And then nobody sits on a desk at home. So they either read on the bed, they read on the floor, all sorts of acrobatics we do while we study. So all that leads to, as you think, if you remember, spine has curves. So these are not, spine is not supposed to be a flat thing. So it has a lumbar curve, it has a cervical curve, thoracic curve. So all these curves, they should be maintained in that profile or to full all whole of our whole life. But that doesn't happen. So we are in the car, is bent forward. We are on the laptop, we are sitting again bent forward. So all this leads slowly to deformity of the spine and then causes a big cause of backache.
And so, do you think the notion that older people will always have spinal issues or orthopedic issues, is that true?
No, 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 it's not. As I told you, we are supposed to walk on our two legs. We are not four legs. So our
Yeah.
spine is always the gravity acts on it. So if we don't make, and it's like a tent pole, which is erect because of the ropes all around it. So if one rope is not acting properly, it might sway to one side. Same thing happens to spine. It is a curved structure which is held together by the muscles all around it. So those muscles need to be sort of maintained well. So and the curve needs posture needs to be maintained well. How you spend your day, that is very important. So it's not only old people. For everyone, that's what it is. Now we have more younger people who think they go to the gym, but yet their diet is not so good. So they ultimately somewhere there is some deficiency which leads a sort of exponential action on this. So you lead to backing.
I think with the change in culture, this has become very common. A lot of people going to the gym now to take care of their health. But do you think there are any specific exercises that people can focus on to maintain their spinal health?
Yeah, very simple exercises actually. If you just do that, one is you just walk. Walking is, in fact, the theme of this year's
Just move your
World
spine.
Spine Day is move your spine. So we sit, if you see, this is a library where everybody is sitting for hours together. So they 3 hours they don't even get up. See, they
Yeah.
are so engrossed in their studies. So that is spine sort of starts getting reacting to this posture. So your muscles become weak, your abdominal muscles become weak. So that is why ultimately when you actually stand up, your muscles are already fatigued. So they sort of cry in pain. So that is why there is backache. So people sleeping on floors, they think that the best thing to do is to sleep on a hard bed, and then that you find. Initially, you may feel better because you have splinted your spine on the floor, hard floor. But then spine, as I told you, is not a flat structure; it's a curved structure. So that's why you need to maintain those curves. So for that, you need to do regular exercise. So walking is one very important and simple exercise. You just walk for 20 to 30 minutes every day. Somehow you can park your car away from your normal parking slot and then walk towards the market. You don't have to go to the nearest spot where you want to shop or somewhere. So park it away so that you have some. Now we have all these gadgets where we can see our steps. So that you can see every day. So now we are luckily having all these feedback mechanisms where we can know that how much we are walking, how much we are doing this. So one is stand and walk. Two is you can do simple back extension. If you have swimming pool or something, you can just have swim once every week or twice a week, and that sort of gives your muscle strengthening. So basically, we need to do a lot of back extension exercises. Your back muscles, the strap muscles, what we call them, they should be well maintained so that we can maintain our erect posture. So while studying, also you need to rest. While driving, you need to generally, if you have long drive, we try to relax and listen to music and keep driving, but that is not the right posture. So your hip level, knee level should be adequately placed so that your back is already supported. You have these chairs which have curves, lumbar curves, so they are good, but you should always sit in contact with those backrests. Don't lean forward all the time. So small things, they really help, and if we follow them and keep walking all the time, like if you every half an hour one should get up and stand and stretch and come back. So those things, small things, they really help in maintaining the spine.
I think Sir's answer really highlights the importance of making everyday smaller choices that lead to spinal health instead of taking extreme measures later when we've already encountered a problem with the spine.
So
And
small things, but you need to remind yourself all the time to do that.
yes,
Very simple.
and I think we all need to keep in mind the theme for this year with Move Your Spine for World Spine Day, and not just remember it on the day off, but make sure that we incorporate that into our everyday choices all year round. So our next question would be, what role does nutrition play in spinal health? As you mentioned, there are a few people who go to the gym, but their diet is inadequate.
Yeah, nutrition is a very important. In fact, in our it's only not for spine, for everything. In these days, we have a lot of different foods available. We have junk food available. We just order online and everything comes to your place. Even the smallest kid knows how to order online. So all these things ultimately they may be short-term feedback satisfaction for us, but then in the long run it goes on. Even people who go to gym, they just keep taking proteins and proteins and protein without balancing the diet. So in fact, I can tell you something. I see so much of vitamin D deficiency and B12 deficiency. See now, vegetarianism is a in thing sort of. People try to be vegetarians while I don't recommend any particular diet, but then you should be also aware that there are certain like B12 deficiency is now very common. So how do you take that B12? So either you have medicine, you have supplements with B12 and vitamin D, and people who are sitting whole day because they leave early in the morning before sunlight in their car, AC car, go to the office, which is a swanky office where they have excellent AC and all that, so facilities, and then they leave in the evening. By the time it is already sunset, so there is no exposure to sun. Although we are high class, upper class society, we have good salaries, and yet we are getting deficiencies. So that is very important. So supplements or diet which should be balanced should be like our own Indian diet is not bad, but the variety should be maintained. Like you can dal khao, one day you have some other variety. So don't keep on taking like you have only office food, and at least there should be some variety so that it's sort of balanced. And as I told you, vitamin D and B12 deficiency is very common now. So particularly for younger patients. In fact, I have patients who just come with their vitamin. They don't come for consultation. They come with their vitamin D levels. And what do I do? It is very simple. You have to take vitamin D and B12 and calcium, everything. So it has to be a mixed diet, everything. So food is very important.
Do you think our lack of sun exposure now also contributes to the vitamin
Yeah, as
D
I told you, so
deficiency? Yeah.
we think we are moving around. I go whole day. I see patients who tell me we are whole day out, but they don't realize that they're not out walking, and they are out in their car.
I
At
get
the
that.
most, they may go to parking and back to the
Come
car.
back.
So they're and there's muscle strengthening. So for bone osteoporosis is a leading cause of disability in back spine. So if you have osteoporosis, your spine is very weak. So you might get even. I have seen patients, young patients who normally, which is very amazing, that normally we used to see osteoporotic fractures in old patients above 60, old ladies. But now we can see it in younger patients also because they get severe bone pains and this because they are deficient in vitamin D, deficient in vitamin B12, calcium deficiency. They are very madly in love with their job. They don't realize. By the time early 30, first 2 decades, 3 decades, body has a lot of potential reserves which to fight all these things. But as we suddenly leave that protective hormonal age group of 20, 30, then we suddenly start getting these all these problems like backache, knee pain, neck pain, all that thing. And besides, posture is a very important thing. Like how your posture during the day. Ergonomics in India is a very weak right now. In Western country, we have departments which are running ergonomics, like how the employees sit in their office. What is their chair like? So it's a very important thing. But in India, it is still yet to catch up. So all these things are important for um, safeguarding this disability of backache.
And so, as spinal issues become more and more common, are there any treatment options or technologies that you find really promising?
Yeah, yeah, no. In my own lifetime, see, I have started orthopedics in 92, 93, and this is hardly 30 years now. There has been a sea of change. Bombay is sort of a hub for change. It is at the cusp of technology in India, Bombay, Chennai, all these big cities. So I have been lucky enough to see this change happen in my lifetime only. When I came to Bombay, spine surgery was a very sort of a basic art. But now we do almost every state of art technology in our own hospital. Like in DY Patil, we do almost everything state of art in DY Patil spine surgery department also. So endoscopy. Now we are all focused on robotics and endoscopy. So everything has suddenly flushed the market. So we see a lot of these endoscopic procedures, robotic procedures happening in spine also, which makes it more precise, more fine, so better results rather than sort of just to decrease the disability. Now we are actually aggressively getting better results.
And would you have any stories to share of patients who've overcome spinal disabilities and gone on to achieve a lot in their lives?
Yeah, for that matter, in every spine surgeon or an orthopedic surgeon, we see a lot of these inspiring stories. That is what I told you inspired
Yeah.
me to take orthopedics. When you see a sort of a paralyzed patient walking, coming to your OPD on walking himself, that is greatest pleasure and pride, and that is the greatest motivator of doing this subject. So there are many stories, people who have come with fall from buildings and then suddenly they had paraplegia, this complete paralysis of the lower back. So timing of those surgeries, whether we do it immediately or later, and the availability of technology to do that, that gives you a lot of pleasure in seeing these patients walk into your OPD with good results.
And so now I think a lot of our listeners are either medical students or medical professionals themselves. So we'll stick to the more medical questions
Sure.
for the next segment. Um, so, from my own experience of my postings during orthopedics, a condition that I often see and I've seen you dealing with is tuberculosis of the spine. It's very relevant in India as a disease. TB is everywhere. So, what do you think is the correct way to manage spinal TB? And what are some misconceptions about it? Because I think TB being a stigmatized disease itself, there are a lot of misconceptions that people have about it, as well as medical professionals.
Yeah, thanks for highlighting this question. I hope I'll be able to do justice to this question. TB, there is a lot of misconceptions still. So we are in 2023, and yet TB is still as it is. We always thought that TB is gone. In fact, your own students community, we think that it's disease of the poor. It happens in slums. It happens in this. No, but I have so many students who are TB patients, and how do they get it? We don't know. They travel in cars. At the most, once in a while, they might have traveled in a train. They are in classes, they're everywhere. So they think that it can't happen to us. So that is something, a big misconception. It can happen to anyone now, even in somebody living in the swankiest tower of the city, he can get TB. So that is one misconception we should think of. So screening is very important for that. So second is that as a spine surgeon or as an orthopedic surgeon, I see a lot of spine tuberculosis, so which is a very debilitating disease. So if you get spine tuberculosis, it is sort of a actually something, a stigma which one should not hold on to. In the sense, it can cause severe disability and You can get paralysis, you can get large abscess, you will need a very big surgery to combat this disease. So that is something which we should pick up very early. The treatment is still, the mainstay of the treatment is still anti-tubercular drugs. So we have to treat them with chemotherapy. That is AKT, what we call as AKTA, anti-COX treatment. So there are protocols for that. The other misconception is that even that is prevalent even in orthopedic surgeons. Like even in city of Mumbai, which is, as I told you, it is on the cusp of medical technologies. We get the technology fastest as compared to rest of the India, but still there is misconceptions even in a known community of orthopedic surgeons. So, like if you've seen a TB patient in the spine, the first tendency is that Indians doctors can identify it easily as compared to some orthopedic surgeon in Switzerland and UK, US. They will not be able to identify tuberculosis because the disease prevalence is very high in our society. So that is, we know the features of the spine, TB spine. So we can pick it up very fast. But then we are overzealous in that as soon as we see TB spine, okay, start AKT, anti-tubercular drugs, four drug, everybody knows down the therapy. But that is now the things have changed. As I told you, TB was initially a very responsive disease to anti-tubercular drugs, but now we see a lot of resistance. I have seen young, in fact, I have a very personal story where a young boy who had got admission to IIT, he developed TB, and then there was resistant TB, highly resistant TB, what we call as XX resistance. Uh, he could not survive. He had admission in IIT. So this is something very tragic stories can happen. So it is important to identify TB, but it is important to diagnose the resistance. So once we have a TB patient, we should immediately do biopsy. So no AKT should be started without doing the culture. So in culture, we see resistance to, because mainstay drugs are INH, rifampicin, ethimetol, pyrazinamide. So resistance to these first line drugs, what we call, is very important before starting the treatment. So we should do culture, aspirate the pus some wherever it is. We have tools to do that, CT guided biopsy, open biopsies, or even what we call as under CIAM guidance biopsies. So culture is very important. So once we have culture, we have now rapid tests, what we call as MGIT, or these PCR based tests, the genetic code material based tests, which sees rifampicin resistance, which sees INH resistance. So now INH resistance, we already initially used to see only rifampicin resistance, but now INH resistance is becoming important. So now, in fact, government protocols say that you should start INH in the rest of the family if there is a detection of TB case. But we are seeing a lot of INH resistance now. So if you give INH to a resistant patient, he will develop probably resistance to all the three, four drugs. So it is very important to do culture. So don't stop anti-tubercular treatment without getting the culture reports. If it is negative, then we can think of. So take help of experts in that, because it is not even an area for an orthopedic surgeon to start AKT. So you should take help of pulmonary tuberculosis, those who treat tuberculosis day in. So our domain is to do surgical management and detection, and then for protocols and algorithms of anti-tubercular treatment, you should also seek help of the experts, tuberculosis experts.
I think that has been very educational for the medical students as well as the practicing orthopedic surgeons. And I really hope that we can take your advice and continue to treat people. I think my next question would be about the biomechanics of the spine. So you talked a lot about the curves in the spine and the natural posture. So I think that is something we can focus on.
Biomechanics, as I told you, spine is something which keeps us erect.
Yeah.
So we have hip joints, we have some on top of that is spine,
Yeah.
and then it holds over this, the whole controller that is the head. So all this falls in a single plumb line. So if we draw, it's a very well balanced curve from cervical lordosis to thoracic kyphosis, and then again lumbar lordosis. So it's sort of an S-shaped curve, which is very well balanced. For both shoulders are on the same level. Our two iliac crests or the pelvic bones are at the same level. So all this is in a single line, which is very well balanced, and which has made us human beings to walk on two legs. So So we have moved, evolved from four-leg stance to two-leg stance. So all this balance of spine is what's, and it is controlled by very important muscles, strap muscles, abdominal muscles. So all this is well balanced. So if there is any change in this balance, the biomechanics, because probably there was scoliosis in childhood, which we have not picked up very early, all this can deteriorate. So that is why screening in the child also is important. Now we have scoliosis screening programs. We have some what's called as hemivertebrae or fused vertebra. All that should be picked up, because if we pick them up in the initial period of growth, while up to 17 years, 18 years, we can treat them very well. Now we have technology where we can correct it very nicely. Otherwise, scoliosis, once you attain maturity, it can all lead to a deformity and then faster disability over a period of time.
I think June is also celebrated as Scoliosis
Yeah.
Awareness Month. So, are there any things that we can do as, normal individuals, or maybe at the school going level, maybe if we can pick this up early on in the kids, would there be any screening methods that we can employ there?
Yeah, we have existing. That is why these organizations they can come in picture, where they sort of educate school teachers and principals, where they can pick up, like even parents can be educated, like when is the menarche got, and whether there is any changes in their uh, posture, because the second growth spurt starts at around 6 to 8 years, and then suddenly there is attaining of height. The kid attains height, then maturity signs like all those things, whether their bones are forming quite okay. So all that thing can be picked up during this period. So training of parents for screening these kids, school children, and then the local hospitals as well as the organizations, like we have Spine Society of India, we have Bombay Orthopedic Society. They do take part in trying to get these screening programs done. So we have scoliosis screening programs and other osteoporosis detection programs. All those things are there.
I really hope these programs become more widespread so we're able to screen these cases and diagnose them faster and get better results and prognosis. I think another question, sir, I had was how important do you think the multidisciplinary approach is to an orthopedics or a spine case?
Oh, that is something we need to always work with the other specialties. Nothing in medical science, unless you cooperate, you will not be getting the best out of yourself. So, in fact, we also now work. Initially, there was a time when every doctor or every orthopedic surgeon used to work individually.
Mhm.
But now the times have changed. Like everybody sort of works in teams. Like my team has uh, different subspecialties. Like I have one more spine surgeon. Then I have somebody who is doing only hip, and then we have neurosurgeon along with us. Then we have rehabs specialists like occupational therapists, physiotherapists. All this works in tandem. So teams are very important. So like in scoliosis, you need somebody to do rehabilitation of that patient, then somebody to make the brace, or then somebody to do the nerve testing and all that. So it is a very important. So if you want really to do get the best result out of a plan for a plan, then you need to work in team. So neurosurgeons, rehabs, specialists, occupational therapists, physiotherapists, neurophysicians, chest therapy, all that thing is a part of team effort.
And so, for our medical students who are thinking of orthopedics as a career choice later in their lives, what advice would you like to share?
Oh, it's a brilliant branch. I have, if I am asked to relive my life, I will again be an orthopedic surgeon. And orthopedic surgery is something which is developing so rapidly. You go to any conference, you go to any, and this you will see now we are almost at a breakneck speed. Like VR, AI, everything is in orthopedics. So even I am. That's what I said. I am a lucky generation, where I have seen the primitive orthopedics also in the same 30 years. We have now moved to handheld AI and handheld VI, where we do navigation for putting screws also. So that is it is a fantastic branch, and I would recommend that you should anybody who has the liking for making somebody as a your plan. Like as I told you, if there's a fracture, you need to do a lot of thinking about it, whether how to do it. There's a lot of brain to be used. There are not definite signs like this. ये मरमर आ गया, ये आ गया, ये आ गया. इसमें there's a lot of planning into it. So आपका दिमाग is always working that how do I fix this fracture. Then we have CT generation of that fracture. So you plan, do a lot of planning, and then now we have navigation and robotics coming in the picture. So that is really fun.
I think that made me question my choices as well. And orthopedics is definitely on the list now. Sir, can I also ask you, are
And
there?
luckily,
Yeah,
sorry to interrupt.
no, of course not.
I'm so amazed and thrilled. We see a lot of girls coming now
Yeah,
in orthopedics. So if you see in our own department, we have almost, I think, four girls, and overall in the city also, in every medical college now we see girls taking orthopedics. It was thought of a very muscular man. You need an
male
orthopedics and to be
dominated
male
fields.
dominated. Of course, emotively we are still male dominated. We can see male abuses and male happening in our OTs, but then I think girls will cool us down physically. But as far as skill is concerned, now we have girls doing it excellent, and I'm sure we have a very bright future with girls participating in orthopedics.
And I hope your answer to the previous question would inspire even more girls to take up
Yeah, sure,
orthopedics as
sure.
well.
We have, in fact, organization now, girl orthopedic surgeons running an organization.
And so I think my last question for the day would be, are there any research topics or advancements that you would still like to see in the field of orthopedics happening?
Yeah, but there is a lot is happening and it is going to happen. As I told you, robotics, VR, this is now the in field, and we see almost every day change happening. We have seen now second generation robots coming into picture. Then regenerative medicine, how do you, like, we still need in very severely comminuted fractures where road traffic accident, where there's a lot of bone loss. So grafts, artificial grafts, regenerative medicine, like how do you develop cartilage? Like we still are not very close to solving the problem of osteoarthritis of the knees, which is a very rampant disease in the sense that everybody will ultimately get either backache or knee problem. So that is almost 80% of our OPD that we see these two conditions. So other than right now only knee replacement is as a long-term solution, accepted solution for knee arthritis. But if we can do something preemptively, like the cartilage is not degenerated, all these things are areas of research which there are people working on these things, but it's yet to catch up very rapidly.
Thank you so much, sir. It
My
was an
pleasure.
honor to interview you, and thank you so much
Thank you.
again
It's a
for giving
pleasure
us
for
the
me
time.
also.
Thank you.
Thank you.
For our listeners, we will be back next month with another episode of DY Med Talks, where we'll be talking about all things medicine, innovation, and research. Thank you so much.
Thank you very much.